All right, so the first thing I'm gonna do is I'm gonna start off by cleaning my work area. So I'm gonna clean it off, and then I'm gonna do some hand hygiene, and then I'm gonna look at my MAR to see the patient that I'm giving medication to and what medication I need. So I'm gonna grab my equipment, the medication, and I have my med cup there. So I'm gonna do my first check. So I'm gonna make sure that the med is for Joe Milton. Joe Milton. I'm gonna make sure that's the right medication. It's risperidone, and that it's the right dose. So this is a 2 milligram tab, and that's exactly what he needs, a 2 milligram tab. So I will give him 1 tablet. All right, so first check done, and then I'm going to, without touching the medication, give him the 1 tab. All right, before I dispense it into my med cup, I'm gonna do my second check, and doing this, I'm also gonna use the 7 rights of medication. So I'm gonna check, again, it's for Joe Milton. Joe Milton, it's the right medication, it's risperidone. The right dose, 2 milligrams, so will be 1 tablet. The right reason, it's risperidone. So risperidone is an antipsychotic, so it might be for Joe Milton's schizophrenia. And then the right route, I know it's an oral medication, so I'm gonna give him an oral tab, or like a pill. And then the right documentation I'm gonna do after as well. And then the time is the 7th one. So it's 8 a.m. and it's 8 a.m. on here, so I know he's due for his pill. All right, so then I'm gonna dispense it into my cup. And then before I put my medication away, I'm gonna do my third check. All right, so it's for Joe Milton. Joe Milton, the medication is risperidone. It's for risperidone, and 2 milligram tablet. So 1 tab, 2 milligrams, and I got 1 tablet there. Perfect, so I'm gonna put my medication away. And I'm going to take my MAR and my medication, and probably a glass of water because he'll need that, but I don't have it right now. And I gotta go to my patient. Before I enter the room, I'm going to do some hand hygiene again. Hi, my name's Cora. I'm gonna be your nurse giving you your medication today. Can you tell me your name?
Joe Milton.
Perfect, and can you tell me your date of birth?
July 15th, 1963.
Great, I'm just gonna check your wristband just to make sure there. Perfect. All right, so I got your risperidone medication here. You're welcome. You take it? Perfect. All right, well, anything I can get you before I leave? Perfect. I'm gonna do some hand hygiene again before I leave the room, or after I leave the room, I guess. Go back to the med room, and I'm gonna document that I gave the medication and so on.